Disclaimer. This video content is AI generated as educational purposes only and is not a substitute for professional medical advice, diagnosis or treatment. Your health concerns may be unique. Always consult your physician or a qualified healthcare provider for personalized guidance.
What if we could actually predict a heart attack before it happens? Well, today we're going to dive into a technology that is trying to do exactly that. It's called CT Coronary Angiography. You'll hear it called CTCA, and believe me, it is completely changing the game when it comes to heart disease. All right, so here's how we're going to break this down. We're going to start with a classic patient dilemma, look at the old way of doing things, and then really dig into how this new tech gives us a whole new viewpoint. We're talking about going from just seeing a problem to actually understanding it, and yeah, maybe even stopping it in its tracks. Okay, so let's jump right in. To really get this, we need to start with a patient, a scenario that honestly plays out in clinics and ERs every single day. It's a massive challenge. So picture this. You've got a 45-year-old guy. He has diabetes, and he comes in with chest pain. But it's kind of weird. Not that classic crushing pain you hear about. His first round of tests, they all come back normal. But with the diabetes, the doctor's still worried, right? This puts him squarely in what we call an intermediate risk group. And that's the million-dollar question, isn't it? How do you know if this guy's arteries are basically a ticking time bomb? The real trick is figuring that out without just jumping straight to a risky, invasive procedure. You might be thinking, well, why not just go in and look? Here's why. The data's pretty clear. Most patients, just like him, do not have a critical blockage. And that invasive test, an angiogram, it's not without risk. Plus, it's expensive, and it uses up a ton of hospital resources. We needed a better first step, a smarter way. So, let's take a look at how we used to handle this. This was the playbook, really the standard of care for decades. All right, the old way was all about stress testing. Now, here's the key thing to understand about a stress test. It isn't actually looking for the plaque itself. Nope. It's looking for the consequence of the plaque, a thing called ischemia. Basically, it asks, is there a blockage so bad that it's already choking off blood flow when the heart is working hard? And this gets us to a huge difference in philosophy. Think of it like this. A stress test is a smoke detector. It's great, but it only goes off when there's already a fire, when the blockage is already causing a big problem. The CTCA scan, though, that's the wiring inspection. It's looking for the frayed, faulty wiring, the plaque itself, so you can fix it before the fire ever starts. See the difference? It's huge. Okay, so let's talk about that wiring inspection. This is the modern approach, and it gives us a view of the heart's arteries that is just fundamentally more powerful. So what is CTCA? It's basically a really high-powered, non-invasive CT scan that gives us this incredible, direct 3D picture of your coronary arteries. We're not looking for the smoke anymore. We are looking directly at the artery wall to see if there's any plaque building up, even the tiniest little bit. And here's how powerful it is. Check this out. It has what's called a negative predictive value of over 95%. Now, what does that mean in plain English? It means if your CTCA scan comes back clean, you can be more than 95% certain that you do not have significant coronary artery disease. It's an unbelievably good way to say, nope, that's not the problem. Okay, so seeing the plaque, that's a huge step one, but it leads to the next critical question. What is that plaque actually doing? Is it causing a traffic jam for blood flow? This is where the tech gets even cooler. Now, here's something that kind of blows people's minds. The size of the blockage, when they say it's a 70% blockage, that number doesn't always tell you how much it's actually messing with your blood flow. Seriously, a 70% blockage in one spot might be less of a problem than a 50% blockage somewhere else. The anatomy, just the picture, isn't the whole story. And that's where this amazing piece of tech called FFRCT comes in. It uses some seriously advanced computer modeling, think computational fluid dynamics, and it takes that 3D picture from the CT scan and then calculates the actual impact on blood flow. It spits out a number, and here's the magic. If that number is 0.80 or less, bam, that tells the doctor this specific plaque is causing a real significant problem. Let's make this real. Look at patient A. The scan shows what looks like a pretty scary 70% blockage. You'd think, oh no, that needs a stent. But wait, the FFRCT calculation comes back at 0.87, which is above that 0.80 cutoff. What does that tell us? That blockage isn't actually hurting the blood flow all that much. So this patient can probably just be treated with medication and we avoid putting in a stent they didn't need. Okay, now let's flip it. Here's patient B. Their blockage looks smaller, only 55%. You might be tempted to say, that's not so bad. But the FFRCT number is 0.75. That's below the line. It's a significant problem. This is the patient who actually needs that stent. You see? This tech makes sure the right people get the right treatment. It stops us from both overtreating and, just as importantly, undertreating. But hold on, because this next part, this is where it goes from being really cool to being truly profound. This is the game-changing power of CTCA, finding tomorrow's heart attack today. Here is the critical, mind-bending insight from decades of research. Most heart attacks, they are not caused by those big, hard, stable blockages that slowly choke off an artery. No, they're caused by smaller, softer, unstable plaques that suddenly rupture and cause a clot. And guess what? These are the exact plaques that a traditional stress test would miss. Every single time. And this is where CTCA shines. Because it can see the artery wall in high def, it can actually spot the telltale signs of these vulnerable plaques. It can see if the plaque has a soft, fatty core that's likely to rupture. It can spot inflammation, where the artery wall is actually bulging outwards. And it can see something called the napkin ring sign, which is basically a thin, fragile cap over this nasty plaque that looks like it's ready to pop. These aren't just pictures. These are biological red flags, warning signs of a heart attack waiting to happen. And that brings us to this idea right here, which just hits the nail on the head. We can now predict a major heart event before it ever causes a problem with blood flow. Before you even have symptoms, we've moved from reacting to a fire to actually predicting where lightning is going to strike. So let's zoom out. Let's pull this all together and really appreciate what a fundamental shift this is for the whole field of cardiology. The old way of thinking about cardiology was reactive. You wait for someone to have chest pain, you do a stress test, and if it's positive, you go fix the blockage. End of story. But this new era, it's all about being proactive. We find the disease, even when it's silent. We look at the plaque, we figure out how dangerous it is, and we treat it aggressively, with the real goal, the ultimate goal, being to prevent the heart attack from ever happening in the first place. This table really lays it all out, doesn't it? Look at this. When it comes to finding early plaque and, crucially, identifying that dangerous, vulnerable plaque, only CTCA gets a checkmark. Stress testing? Nope, it's looking for a flow problem. Invasive angio? Nope, it can't see inside the artery wall to see those features. This is why CTCA is becoming such a go-to tool for those intermediate risk folks. It just gives us so much more information to act on. And really, it all comes down to this. For so long, heart care was about treating chest pain. It was about fixing a blockage after it got bad. But with tools like CTCA-C, that's all changing. The new goal isn't just to make the chest pain go away. The goal is to prevent the heart attack entirely. We are, finally, moving away from just putting out fires and starting to truly inspect the wiring.